So this is our pelvic independent reset drill. So this is a good way to mimic orthopedic manual therapy to correct pelvic positioning and get the pelvis to move. So what we're mimicking here is the clinician driving and resisting the hips being an abduction, moving out and away from midline. And then the second part is resisting or mimicking the clinician resisting you in adduction, squeezing towards midline. So the best way to do that, small monster band comes up around the thighs, just below the knees. The athlete or patient then produces a 10-second isometric, driving out into the band, fatiguing the lateral glutes. After that 10-second point, something like a foam roll or even like a rolled up pillow then comes between the knees. So then you're gonna squeeze, hold that, isometric contraction, 10 seconds again, and then relax. That process of squeezing in and driving out is going to be repeated 3 times. Okay. Second phase now. We're going to remove the monster band, slide it out. Now we need to go into hip flexion, hip extension. So clinically, we would be taking you up to 90 degrees. This knee would be driving towards the chest. This leg would be driving towards me, and I would be helping you resist here. However, back to independent training, what we would then do is now the athlete takes one hip, comes past 90 degrees, both hands come to the thigh, and you're gonna push into the thigh, resisting yourself and matching yourself, while the opposite heel drives into the ground. So we're producing this X of contraction, or excuse me, this diagonal, 10 seconds again, relaxing, and then immediately switching to the opposite diagonal. Again, heel drives down, resisting and just matching your own pressure, 10 seconds, and then relax. So that, sometimes we refer to this as the scissor or the diagonal press. 10 seconds, 3 times per diagonal, always alternating the diagonal. Now quickly here, while we're in the same position, immediately following this pelvic reset, we want to turn on some of the micromusculature of the pelvis and low back. We're talking muscles this size, okay? This system is going to lace up the spine from the pelvis all the way to the back of the skull. It is an anti-movement muscular system, which needs to be re-educated to have a better chance of maintaining those movement gains that you just created. So both hands come out to the side here. We're going to be making a diagonal again. Right heel, mild pressure down. Left shoulder blade, mild pressure down. Left hand, pressure down. Again, playing on that diagonal. We're just resisting any actual rotation or movement. Doesn't have to be that intense. Just mild to moderate pressure only. There's 10 seconds. We're going to then alternate the other diagonal. Left heel, right blade, right hand, 10-second hold again. And again, not working hard enough to actually facilitate any rotation or shift in the pelvis. And relax. Same as before, 3 rounds per diagonal. Each time is being held for 10 seconds, and then alternating diagonals each time. Okay, so there's our self-care pelvic reset, and then our pelvic X stabilization drill to maintain the benefit.